Hello and welcome to the print video. I am Sumi Sukanya Datta. You would be hearing a lot about rising COVID-19 cases. But is that a cause of concern? Do we really need booster vaccines for this? Also, what measures can we take to protect ourselves and our families? To answer all these questions, we have with us Dr. Chandrakant Laharia. Dr. Chandrakant Laharia is a public health expert and has previously been with the World Health Organization in India. He now runs his own health research organization. He's also authored a book on COVID in the past. Thank you so much, sir, for joining us in this conversation today.
Thank you very much. Thank you very much for inviting me here.
So, first of all, we would want to understand from you how do you see the rise in COVID 19 cases as of now in India, as well as in some other countries in Asia, particularly? What are the lineages, virus lineages, which may be driving this surge?
Thank you. So let's understand the respiratory viruses. We
Mhm.
know that all respiratory viruses, no matter which one it is, whether it's a flu virus or SARS-CoV-2 or respiratory syncytial virus, uh, all of these viruses have a seasonal pattern. In fact, in September 2020, Mirioma and colleague published a study in a journal of Annals of Virology, where they had studied that for thousands of years, we know that respiratory viruses follow a seasonal pattern. Now, for flu, we know the seasonal pattern is usually winters in the European settings, but in India, like February, March is the flu season in India, then rainy season is flu season. So for flu virus, we know the seasonal pattern.
Mhm.
SARS-CoV-2 is a new virus, but it's a respiratory virus. So it is likely to have a seasonal pattern. But till now, the seasonality of the pattern has not been established. But for example, in Singapore, which has a good data available, they have estimated that every 6 to 9 months there are spike in seasonal spikes in a SARS-CoV-2. Now, if we go
Okay.
for India-specific data, we know that Omicron was first reported in December 2021, and then January 22 we had an Omicron wave. After that, we had seen a lull, and then there was a spike in January 2023. We had also
Mhm.
seen a spike in July, August last year, and now we are seeing a fresh spike in May. So what we are seeing that usually every 9 to 12 months there is a spike in SARS-CoV-2 case, but we are not still very clear that how much what is the exact pattern. But it is very true that even SARS-CoV-2 will have a seasonal pattern. That's one. Second
Okay.
part is that what we are seeing currently, India has reported, like we are reading that there is a uh, more than 1,000 active cases in the country. But we need to remember that the approach of counting 1,000 active cases is wrong, because what we have seen in the week of May 19 to week of May till May 26, in the 7 days, there were around 700 new cases, which essentially translate to around 100 new COVID-19 cases in a day. Now, for a country of size of India, like 140 crore, 100 new cases in a day means approximately one new COVID-19 case for 1.4 crore population. The point I want to emphasize is that the number of COVID-19 cases which are being reported in India is very low. If we compare with other health conditions, for example, we take tuberculosis. Every day, 8,000 new cases of tuberculosis happens in the country. Every day, around 900 people die due to tuberculosis in the country. So, similarly, for if we take an example of other respiratory illnesses, influenza, respiratory syncytial viruses, the cases are far greater. So current uptake is though theoretically uptake, but it is not a major number for the size of the population of the country. Uh, we also need to remember that though there are few deaths are being reported in the country, like one or two deaths due to COVID-19, but
Mhm.
India has, in everyday India, approximately 30,000 deaths are reported. I'm not discounting the deaths due to COVID-19, but what we know that those deaths which are being attributed to COVID are essentially deaths due to some other causes, but they had other deaths also. To put this again in the perspective, in front of 30,000 deaths in a day due to old age, other causes, one or two deaths, a disease condition with one or two deaths would come far, far lower. So if we put all of these things together, the absolute number of cases in a day, the deaths being attributed, and when we compare with other health conditions. So even though there is an uptick, but then it's not a concern. We also know that even if there are cases, it is not concern because we are not hearing about moderate to severe illness. So mere infection is not concern. We would say that a rise in cases would happen because that is a seasonality of respiratory viruses.
Thank you so much for putting things in perspective and giving context to these numbers. But one concern that many viewers would like to probably will have and would like an answer to is that India doesn't really have a vaccine specific to these virus strains which are in circulation. We do have many vaccines which were made indigenously, developed indigenously. Some of them were procured from outside and produced in India, but we don't really have a vaccine specific for Omicron or its sublineages. So do you see that as a concern if, for example, there could be a group of people, if the number of infections rise, who might need a booster dose, for example? So what can these people do in that case?
So Indian population or any population for that matter does not need fresh shot of COVID-19 vaccine. Let me tell you why. There is
Mhm.
no need any additional shot of COVID-19 vaccine because the way COVID-19 vaccines are designed, they do not protect from the infection. In fact, none of the COVID-19 vaccine except some mRNA-based vaccine which reduce a proportion of infection. So the vaccines which had been used in India or in many other countries do not protect from infection. Vaccines protect from a moderate to severe illness. Now, even if we have vaccine and we administer vaccine, the infection cannot be prevented. So why give vaccine? Second thing is that since we are not getting reports of moderate to severe illness, the moderate to severe illnesses are not happening, which can be prevented by vaccine. So we don't need vaccine. So either
Okay.
way we look at it, that vaccines do not protect from infection, so they are not needed. Then the moderate severe illness, which is protected by vaccines, is not happening, so we do not need vaccine. That's one of the justification for no need of additional shot. Now,
Okay.
second part is that because we know that vaccines might be useful in some cases, but we know that in India, in the initial 3 years between 2020 to 2022, there were a series of infections due to various variants of COVID-19. Then most of Indian adult population has received 2 shots of COVID-19 vaccine. Now, this has created a scenario of hybrid immunity. Now, we also know third thing that though SARS-CoV-2 cases had come down, but virus had not gone anywhere. Virus was present in the community, but it was not causing detectable infection. So the presence of virus in the community indirectly and with the subclinical cases would have contributed as a booster effect on the population. So these are the three aspects that our India's population's immunity against COVID-19 continue to hold. Yes, uh, to certain extent, with the time immunity wanes off or goes down, but then we know that the detectable antibody against a certain pathogen goes down, but immune system is much more complex and it has something called memory cells. Now those memory cells of immune systems are far and few. They are not tested and not detected, but they are definitely found. So in the future, whenever infection happens due to a virus, the memory cells quickly replicate and start providing protection. And final point here is that though we are seeing uptake, but this uptake is due to a variant called JN.1. Now, JN.1 is a sublineage of Omicron variant, which had
Mhm.
come in November, December 2021. And now Omicron variant, which had come, and entire India's population has been exposed to Omicron variant. Now, Omicron variant sublineage JN.1 is circulating in India and other parts of the world. It had never been designated as a variant of concern. So the last variant of concern, which had been seen in any part of the world, is Omicron variant. So the subvariant of last variant of concern is likely to be little different, but not very different. What we see in the last 3 years, because if it had not changed that much, it means that it's not that high transmissible. It is definitely we know that it does not cause much of the immune escape, Putting all of this in summary, with hybrid immunity, not a new variant of concern, our immune system holding up and memory cell present, of course, some immunity would have come down, but I think we are protected and there is no need of additional vaccine for any population group, for any age group in India. And so, though we do not have a vaccines available in the country, but we do not need vaccines either in the country. And I'm talking about COVID-19 vaccines. Of course, there are other vaccines such as influenza vaccine, which can be given to population to protect against the flu viruses, which are more prevalent. And now what happens, I'm saying that why influenza vaccine or other vaccines should be given, because if all of these viruses circulate together, if someone get flu infection, influenza virus infection, his or her immune system will be fighting that flu virus. And then if that person get another viral infection such as SARS-CoV-2 or any bacterial infection, they are more likely to have a relatively moderate to severe disease. So if you are protected from one disease, your immune system is ready to fight another one. So it's always better to have utilize available vaccines such as influenza vaccine. Let's not worry about COVID-19 vaccines. As per current scientific evidence, they are not needed.
All that information is really reassuring to know, sir. But just one key message, correct me if I'm wrong, is that people who need some sort of, who probably who have a compromised immunity or elderly, they can benefit from influenza vaccine, but probably don't need a COVID booster shot as yet. Is that what you're saying?
There is no need of COVID-19 booster shot for any population group.
Yeah,
But the flu
that
vaccines are recommended for anyone who has a pre-existing comorbidity, but any adult who is at risk of disease can get flu vaccination.
yeah, that's a very important message there. Now coming to the point of India's preparedness, we have seen what happened in the first two waves, particularly the second wave, which was really deadly, Delta wave. Do you think, God forbid, I understand that probably at this point we are not in a position, the virus is not in a position to land up more people in hospitals, but in future if we have this same virus evolving in a more dangerous one, which is capable of causing severe diseases or any other viruses, how do you see India's preparedness as compared to pre-COVID era?
Though there are certain things which cannot be predicted, but going by scientific understanding, SARS-CoV-2, even if it evolves in something, is unlikely to have a kind of impact which we had seen in 2020 or 2021. Only a
Mhm.
new novel virus can do this thing, but existing virus against which population is protected through natural infection or vaccination is unlikely to do that kind of damage which we had seen in the past. So we don't have to be that much worried. Having said that, regarding preparedness or emergence of new viruses, of course, we should assume and we would assume that if something similar comes up, we would be able to handle it. However, there are a few more learnings that there is a need for a health system to continuously be prepared for such kind of emerging threats and pathogens. In that context, a recent World Health Assembly, World Health Organization led pandemic agreement is one of the key factors. So we believe, we really do not know what would happen on the ground when actual situation arrives, but we believe that world is more in agreement to fight such kind of pathogens. Regarding another aspect, if we have to fight the diseases, we of course have a fresh learnings in the last 5 years. Though some of the learning is that it required individual intervention, it required societal intervention, it required government or policy level intervention, it required international collaboration. The role of vaccines, the role of newer medications is equally important. Getting health system ready is equally important. Of course, we can keep talking about these in detail, but one of the point in learning which I wish to flag even in the context of current uptake is infodemics or misinformation. Like
Absolutely.
the moment we are hearing these emerging cases, which are like, as I flagged earlier, highlighted earlier, they are very far and few. For a country of size of India, 100 new cases daily of a respiratory illness, which is not even causing like moderate to severe illness, but it has created some panic. There are forwards going on. There are people who are talking about lockdown or containment. So the kind of misinformation we have seen in the past and we still continue to be seen in one disease, another disease. A few months ago, we heard about HMPV virus, which was like barely any information. So we are hearing these misinformation and panic situations in the and through the social media. So bigger response is that we need to be more responsible at individual and societal level in passing on the information. We need to be little more analytical. We need to read information from reliable sources, and all of these require to fight diseases. If we understand that how disease is spread, part if you are stressed, it goes down, you are actually scaring people and that might contribute to the spread of the disease. So it requires intervention at multiple level. In summary, we as a nation are definitely prepared for responding to any uptake or surge in COVID-19 cases. We had seen that as soon as there were reports from Singapore, Hong Kong, Thailand about uptick in the cases, Indian governments did a review of the situation, gave direction to the states to strengthen the surveillance or enhance the surveillance and testing. And my analysis says that though there might be some uptick in COVID-19 cases, in the country, but part of the increase in the cases is due to increased testing, increased surveillance in across the country. When you test more, you detect more, and that probably is happening.
Yeah.
Otherwise, there is not enough scientific rationale to believe that a variant which is circulating for nearly like 1.5 years, the JN.1 was first detected in August 2023 in Luxembourg. In India, JN.1 was first detected in November, December 2023. So it's nearly 16, 17 months since when JN.1 is present. And a variant to be like something which is more serious, it becomes very serious. Like we know with Omicron that by the time it was detected, and within few weeks it spread to the many parts of the country. So current epidemiological and clinical evidence does not indicate that we are heading into uptake. If there
Yeah.
is any uptake, it will going to be minor. And I would say for a country like India, even if cases go manifold, if we detect, it's not a concern as long as like it is not causing moderate to severe illness, it is not leading to hospitalization. It's not a concern. Mere infection is not a cause of concern. We have seen in Omicron wave that nearly everyone got affected, but thanks to previous infections and thanks to vaccination, that there were barely any moderate or severe illness. With the current JN.1 and current uptake, even if uptake happens by, let's say, like we are getting around 100 daily cases every day, even if the 5,000, 10,000 numbers of infection does not make sense or does not make much difference until it is like a moderate to severe illness, unless it affects this thing. Of course, we do not want a bigger population to getting infected and then coughing, sneezing, but and for that we need to do preventive measures.
Again, very important messages and put in a very simple manner. Thank you so much for that. But lastly, would you like to give some message to people watching this in order to prevent this infection and also protect those who may have comorbid conditions as well as some underlying immunity related issues?
Thanks. So first point, there is no current scientific evidence that there is a uptake or major rise coming in the COVID-19 cases. So COVID-19 current variant continue to be the old variant, and it is not causing serious illness. We might expect some minor uptake now, maybe a few months later, so we should be prepared for those. It is like the way it happens for other respiratory illnesses. Second, we don't need COVID-19 vaccine additional shot. We are protected. If there would be additional need for additional shot, those will be available in the time ahead. But right now and possibly in the near future, we don't need COVID-19 vaccine shots. Third, we should protect ourselves from all respiratory illnesses. SARS-CoV-2 or COVID-19 is much lower in the hierarchy of causing severe disease like influenza virus, respiratory syncytial viruses. Even tuberculosis is a common disease in our country, so we should protect ourselves from all the respiratory illnesses. For that, approach is same when there is a particular disease season, follow the preventive measures. For example, in flu season, you should protect yourself by eating healthy, keeping yourself dehydrated, If someone has cough, cold, and sneezing, then cover your face and mouth. That is required for your protection and someone else's protection. Irrespective whether it's a particular disease condition uptake or flu season, anyone who has a pre-existing health condition, anyone who is on the long-term treatment, that individual should follow preventive measures. That individual should get treatment for the pre-existing health condition, and that way you protect yourself from the disease condition you have, and you protect yourself from other possible infections. Finally, I would say that our government is at the both national level and state level are doing fairly well as far as these infections are concerned. Uh, we as a citizen and we as an individual can contribute it by not spreading misinformation, not spreading forward which are not verified. Always
Right.
read information from reliable sources. And then, even if you think that you have caught any health condition or any virus, go to a healthcare provider. Individualized management, individualized treatment will take care of you. I am confident that no new COVID-19 wave is coming in the country. There is no likelihood of any fresh COVID-19 wave which can impact population in this country.
Very useful advice. I'm sure our viewers will immensely benefit from it. So, one, there is a misinformation pandemic which is also parallelly going on. We should all try not to contribute to it. With that, we wrap up this conversation. Really appreciate Dr. Laharia joining us in this important conversation. Thank you so much, sir.